Hello there, welcome to Plus Talk on Plus Life. We're all about turning positive into a plus. We are talking sex and HIV today, and joining me, Dr. Joshua Gonzalez, board-certified, fellowship-trained urologist and sexual medicine expert. You're also the co-founder of Popstar Labs, and I have to say, creates fantastic social media content. Check out at Joshua Gonzalez, MD. Good to see you, Doc.
Good to see you too.
What an introduction.
I know, I appreciate it.
Let's dive straight in. So, you know, HIV still carries huge stigma, especially around sexual health. What's holding us back from having sort of the open conversations and changing that?
I mean, I think there's a lot of hurdles to overcome. I think one is just sort of lack of education, right? There's a lot of people who don't understand the advances that have been made in HIV care, the fact that if you're undetectable, you cannot transmit the virus. So I think those are some barriers. I think there's cultural barriers. There's still a lot of stigma associated with HIV because of what we went through in the 80s and 90s with the AIDS crisis. I think there are, the way people are brought up, whether that be with religion or the families they grow up in, having certain ideas around sex and HIV being thought of as almost as a punishment that people,
you deserve it because you're gay.
Exactly,
kind of
exactly,
right?
Like
behavior.
Right, you were too promiscuous and this is your punishment, sort of thing. So those are all things that I think we have to get over.
Yeah, and I think for a lot of people, men especially, who are living with HIV, at some point or another, we can face performance issues, sort of in the bedroom specifically. But it's not all just physical, right? So how much does things like stigma and fear and shame affect one's sexual health and confidence?
Yeah, I mean, that's a good question. When I see patients who are coming to me with some sort of performance issue, usually with men, we're talking about erectile dysfunction.
Right.
I try to normalize the psychological aspects and factors that play a role in their dysfunction, because as a man who is interested in sex and wants to connect with their partner or partners, but is just having a problem performing, it can be incredibly frustrating. So that creates anxiety, that creates stress that carries over into future encounters, right? Then you add onto that or layer onto that, maybe some shame that they have about their diagnosis, or maybe some shame that they have about things that have happened in the past. That I would say in 100% of cases, those factors are present. It's just how do you learn how to manage them? And my job is really to figure out what physiological aspects may be optimized to kind of give you a better chance at performing well.
Yeah, so to that point, you're a urologist, you're a sexual medicine expert. Yeah. How does urological care help people with HIV overcome performance issues and build sexual well-being?
I think it's the same for people who are HIV positive or negative, right? Like, sexual health is one aspect of, in my opinion, a very important aspect of your overall health. And there are things that occur in sexual health that actually can clue us into some underlying health issues that may not have been diagnosed yet. So again, using erectile dysfunction as an example, there's tons of data demonstrating that men who present with erectile dysfunction, especially kind of earlier in their, say, early 40s, those men should probably be screened for underlying cardiovascular disease because erectile dysfunction is often the first symptom of undiagnosed cardiovascular disease. So I would say that prioritizing sexual health is important for all men because it is often sort of a microcosm of how healthy they are in general.
Yeah, that's really interesting about the heart thing. You talked about U equals U a minute ago. It really is a game changer for those of us living with HIV. How is the shift, do you think, in understanding that empowered individuals to enjoy sex without fear and to really impact those people who are not living with HIV to engage freely and enjoy sex with people who are HIV positive?
Yeah, I mean, I think that the U equals U and the advent of medications, PrEP medications, right?
Yep.
Really allow people to get out of their heads and stop worrying so much about the risk of contracting this virus, right? And so I think it opens up the possibility for people to connect with more individuals, right? I think the problem is we need to educate people better about what these two advances really mean, and I think it's going to just allow for more people to connect and find each other.
Well, I think as someone living with HIV, and I can speak to this, I've experienced this, an HIV diagnosis can really dim your desire, your self-desire, your sense of self, especially in the bedroom. And for when you're a young guy, you know, in your 20s or something, and you're diagnosed, this is when you're like meant to be at the peak of your sexual game. What's your go-to advice for people to sort of reignite that spark or reconnect with pleasure?
That's a good question. I mean, I think it's got to be multifaceted, right? So like if we're talking about a decrease in desire, you know, I would want to talk to that person about doing an evaluation. Let's see what's going on with your hormones. Let's see what other factors may be at play here. HIV, when you have it for a long period of time, does put you at risk for having things like low testosterone, right? So having that evaluated, making sure that we're optimizing someone's hormones, because it's very important for desire. If we're talking about erectile dysfunction, trying to figure out, is this a situational thing? Is it just happening with partners? Or are you noticing a decline in your erectile function even when you're alone and masturbating? And trying to give them tools to help improve their erections, whether that be, you know, medications or referring them to a therapist, or you know, group therapy where they can kind of talk through some of the things that they may be struggling with psychologically that may be playing a role. You sort of have to approach these dysfunctions from a variety of different angles.
How do you overcome the stigma? Because I think, you know, put HIV stigma aside, I think a lot of men are uncomfortable about talking about this topic. And, you know, it's one big thing to go and see you, let alone you know, talk about different things you can do to help with erectile dysfunction. How do you help people get out of their heads about that?
Well, I mean, I think that's a big part of what I try to do with social media, right? I think that has been a game changer in terms of being able to have strangers connect with providers who work in a particular space, right? And in my space is sexual health. I recognize, both as a gay man and just as a person, that if you struggle with a sexual dysfunction, it's not the easiest thing to talk to your friends about, right? It's not easy to necessarily bring up with your primary care provider. It's historically hasn't been an easy thing to seek help for. And I think with social media, people can now, you know, type in erectile dysfunction in their TikTok search bar.
And we find you.
Yeah, exactly. or in Google and search for providers near them, do some research on them, see what kind of, you know, content they're creating on social media. And so I think that's a way to kind of start to break a little bit of the stigma, to just have them see that, like, just, you know, as they scroll past, you know, funny dance videos, they can also learn a little bit about the condition that they might be struggling with. And the way I create my content is to really try to do it from like a fun, lighthearted, entertaining kind of way to disarm people so that they can get some helpful information, learn about their condition, but also not feel so bad about it because it's done in a lighthearted way.
Yeah, your content is fantastic. Thank you. When someone feels like HIV has really taken control of their sex life, what's one empowering kind of mindset or action that you'd recommend to help them take it back?
I mean, I would say, first of all, trying to help them understand that they're not alone, right? Like, I think when someone is first given a diagnosis of HIV, it can feel very isolating. So trying to maybe help them connect with other people like them who are, you know, living and thriving with HIV, who probably were in their shoes at some point, you know, early on in their diagnosis. And then again, kind of giving them the tools that they need through medications, through resources, for mental health, all of that sort of stuff, to just help them kind of get over that stigma and those sort of mental blocks in their head.
Yeah, and I think if you're a person who is struggling, don't be afraid to reach out to people like you.
Yeah, and finding providers that, you know, are in your community, right? Like, I think that the work that I do is meaningful, but I think it's especially meaningful for gay men because they know that I'm gay, right? And they feel comfortable. When I'm talking to patients, I use slang words that they would otherwise use with their friends to, again, help them feel like, okay, this is somebody that I can talk to honestly and openly about the problem that I'm having. And the more that they can be honest with me and tell me all of the details, the better I'm gonna, you know, be at helping them fix their problem.
Well, this has been a really insightful conversation, Dr. Joshua Gonzalez. Thank you, sir.
Yeah,
You got to check him out at Joshua Gonzalez, MD. I really appreciate the time.
Yeah, thanks for having me.
That is going to do it for this episode of Plus Talk. If this conversation sparked an interest, leave a comment below. And remember, you can like, follow, and share. We're across all your favorite social platforms at Plus Life Media. Remember, your sexual health is yours to own, so don't let a diagnosis take away any of that. Until next time, be nice to one another. See you soon.